We are here today with Dr. Brian Helmly. Thank you so much for joining us. This is a real treat. It's a Friday afternoon here at Coastal Carolina Hospital, and it was really interesting for me to see all of the activity here on a Friday afternoon. And I am thrilled to talk to you, first of all, because I'm really interested in what you're doing. So Dr. Helmly, tell us a little bit about where we are, what we're doing, and about what imaging really is.
Yeah, well, thanks for having me here.
Mm-hmm.
And so we're actually in the PET scanner this afternoon. This is a newer service that we're starting to offer here.
Mm-hmm.
Right now they're coming on Fridays. PET CT is, as I think we talked about before, is a relatively common medical procedure that's out there, but it's new to have it in this area. It's a big advantage because patients no longer have to travel long distances, Savannah, Charleston, wherever, to have this type of care.
Can you talk to me a little bit about CT scans, MRIs, different kinds of imaging, and a little bit about what each one is, and then we'll that's broad spectrum.
Right.
Then we'll come back down to some more singular things.
Yeah, so CT is actually part of this right here is the CT scanner. So they all look very similar. The big hole you kind of slide into the donut.
All right.
CT uses radiation, and by doing so we can look kind of internal structures where it's brain, chest, abdomen, pelvis, what have you. And kind of get an idea of what's going on. To actually see the structures, and to see if there's an inflammatory process or cancer, and to let your doctor know ultimately what's going on. MRI, very similar, no radiation. It's actually a magnetic field.
Okay.
So there's certain advantages to MRI, particularly in the brain, prostate, other areas that CT may have a weakness on. Mm-hmm. But the concept is pretty similar. It's a tube. We slide you in. CT, you're only in there for a minute or two. You're kind of in, you're out. MRI, you're a little more permanent. You're going to sit there for maybe 30 minutes or so.
And then a PET scan.
Okay. So a PET, which is what this is, like I said, has a CT. And so
it has a CAT scan.
It has a CAT scan, and it also has the PET portion of it. And so it makes it a little different. So in this regard, patients get scheduled for a PET scan.
Positive, what's it called? PET? Oh, yeah.
Positron emission tomography.
Thank you. I was testing you on that
think
one.
For a second. So what happens is the patients come in. They will have some labs drawn, check their glucose, those type of things. We'll inject them with a radiopharmaceutical. Okay. And then we put them in a quiet room for about an hour.
All right.
We want them just relaxed, very quiet, not moving a lot. And then ultimately we'll bring them back over here. The CT portion of the exam, again, is very quick, just a few minutes. The PET scan takes a little longer, total time anywhere from maybe 45 minutes to an hour, just depending, to get the scan.
Let me ask you a question about really how all of this works. I think you and I chatted a little bit before we even started, and I think when you're told you need to get a CT scan or a PET scan or an MRI, it can be a little bit intimidating. How do I, as a consumer or a patient, drive this process? In other words, it's really interesting for me to be able to look at you, talk to you, know a little bit about what you do, and at this portion of the show, I'd love to say you really specialize on abdomen.
I do. I'm a body or an abdominal fellow, so kind of here to here is what my area of expertise is.
So that's kind of interesting. So how can I be an informed consumer?
Yeah, so I think, obviously your physician's going to be the one that's going to order the exam. So obviously they're a great starting point, right? But after that, where you go and what type of exam you're having, I mean, that's a conversation with your doctor. And then look, the information's out there now.
So there are choices, is what you're telling me?
Oh, there's absolutely choices. As a patient, it's ultimately your choice. You can have an exam anywhere you want. Some of that may be dictated by insurance, but for the most part, it's your choice.
One of the things that you said was that you were really impressed with the hospitals here, and some of the things that you do quite a few prostates. You do quite a few of these.
Right. I mean, for Coastal Carolina particularly is a smaller hospital, but the prostate volume they do here is impressive. We do probably more prostate MR here between here and Hilton Head combined than anywhere around.
How long have you actually been practicing?
I've been out of practice now for almost 4 years.
Have you really? Where's your background? Because it's really fun. I already know the answer to this, but I want everybody
So I'm originally from Savannah.
Okay.
My wife's from right outside Savannah. I did my medical school training at Mercer in Macon. Did my residency in Savannah. Okay. And then went to the Mayo Clinic for a year for fellowship, again doing abdominal imaging.
All the abdominal stuff.
Right. And then been back for almost 4 years now.
So really, we don't have to go across any river to get the top-notch treatment here.
No, not at all. I mean, when you look at what's offered in kind of the Hilton Head system now, especially with this edition coming, at least once a week, it's nice. It provides a local service for patients where they don't have to, travel these long distances to get the ultimately the same services at home.
Okay, now I want to talk a little more specific. A PET scan is used for what specifically versus an MRI
Right.
for what specifically versus a CAT scan?
So there's a little variation there, but
Okay.
just PETs in general. When we say PETs, we typically refer to what me or one of my colleagues would say is an FDG PET. Now there are
Okay.
multiple types of PET scans out there. Okay, some are very specialized, but just kind of the general layman, a PET scan is an FDG scan, which is what we would be doing here today. Most commonly, it's going to be staging or restaging cancer.
Okay.
There are some other things, maybe some pulmonary nodule evaluation, some neuro exams, but for the most part, it's going to be staging and restaging cancer.
But why is that so important? Why is it different? Why does this make it such a special machine?
Yeah, so when we look at, trying to either detect or follow a cancer,
Okay.
size is hard, and we know that. So when we have say a little nodule in a lung or in the liver, we may see that on a CT scan, but sometimes it's hard to know, was that cancer or is it just a cyst?
Okay.
And so when the FDG PETs, they're really trying to utilize kind of metabolic activity, and
Got
the
it.
theory behind that is that cancer cells are a little more metabolic than normal tissue. And so we're hoping that something that we maybe see on a regular CT scan that we're just not sure about, that on the PET can answer that question.
So it is almost, does it predict as well as show specific?
It's actually very sensitive,
Okay.
meaning that other things can light up as well. So one of the questions we always like to ask patients before they come in, have you been sick lately? Have you had any illness? And the reason's because if you've had any type of pneumonia, infection, inflammatory,
Ding, ding, ding,
it's going to
ding.
light up on the PET scan. And now the radiologist is kind of stuck in a predicament where he didn't really maybe know your history. Is this bad cancer, or is this just a pneumonia that's going to go away?
One of the things that's been interesting to me that I've learned about radiology is you're very diagnostic. I think people are like, oh, they read, but you're actually making the assessment.
Correct.
You and your team.
Correct. Yeah, historically you're the doctor's doctor because
Right.
As a patient I don't
Exactly.
always get to interact with you. Maybe during procedures or during the mammo process, but day to day it's not a ton. So.
All right, so we talked about the PET scan. Let's talk about the CT scan because I think that's what everyone hears about all the time.
Right, it's common.
Do we have different kinds of CT scans?
Yes and no.
Okay.
CT in general, they're different. Some scanners are a little more advanced than others, they're a little faster, they have a little more resolution, but the principle is the same, how the image is acquired, that type thing.
And what does that look like? What am I doing with a CAT scan, and when would that be an appropriate thing?
So again, CAT scan is, outside of an X-ray, is probably one of the most utilized imaging techniques today. Obviously, cancer workup comes into play there. Trauma, maybe abdominal pain where your physician's worried about a particular diagnosis, appendicitis, diverticulitis, those type things.
Okay.
A pneumonia that doesn't go away. The list is actually quite extensive as to why someone would have a
Am
CT
I looking
scan.
at something different from a CT scan than I am from an MRI?
Sometimes. Again, so the CT uses radiation, so CT is really good at certain things. So like for a heart, for instance, we can really see the coronary vessels quite nicely on the cardiac CTA. On an MRI, you're never going to see the coronary vessels.
Okay.
We do MRIs of the heart, but not for that reason. So sometimes they're more complementary than they are actually looking at the same thing.
So then an MRI is used specifically for what?
So MRI can be, again, a little broad, but much better imaging of the brain.
Okay. Oh,
So
brain. Okay.
stroke workup.
Okay.
MRI is going to be much more specific than a CT. Prostate, like we touched on earlier, CT really has no role in looking at the prostate itself, where MRI has a pretty big role nowadays. If we see something in the liver that we can't problem solve on a CT, an MRI is almost the standard. So it gives you an extra little bit of information that's really helpful, but there's an extra cost, it's a little more involved, so we don't always just jump to it first thing.
Do you think that there is a mystery surrounding these kinds of tests, and do we need to be concerned or worried? Because I think what I've learned, my son's a radiologist, so we were talking about that, is he's kind of demystified a lot of this for me.
Yeah, I do. I think that radiology in general to most patients is something that's they're just not really familiar with.
Right.
They get told to go have these tests and they don't really know where they're going or what they're getting into. And we see it all the time. The patient shows up and we're telling them kind of what we're going to do, and you can tell immediately that they have no clue.
Right. So what I'm learning, and this is always fun, I love to do a takeaway when we talk to doctors and things like that. Here's what I've learned today. I've learned that I can advocate for myself.
Correct.
when someone says I need one of the scans, I've got choices and options, which I think is really important. Here's a big one. I've learned that we've got the best right here in our low country, which is really pretty exciting.
Yeah,
and I mean, it's really pretty impressive. I do appreciate everything. Again, it's so nice to meet you.
Right.
Appreciate
Very
your time.
nice to meet you.
We want to
Thanks
thank
again.
all of you. You know what? We've actually got 30 more seconds, so I'm going to sneak
Let's do it.
one more thing in here. What about, because I'm a woman, what about mammography?
Yeah, so depending on the campus, at the BMC and at Hilton Head, we offer 3D mammography.
Okay.
Here at Coastal, we still do the traditional 2Ds, but no matter where you have your mammogram, we, as a group, we kind of funnel that workflow to BMC. And the reason we do that is because we feel it's important, and I think that the organization does as well, that we keep our kind of fellow, like I said, I'm a body guy,
Yeah.
and so we keep our fellowship-trained mammographer there.
Okay.
And so that's all the memos from no matter where are coming in, being read by kind of a dedicated breast specialist, if you will.
2D, 3D, does it matter? Are some indicated more than
Yeah,
others?
so 3D has really kind of taken charge in the last few years.
Okay.
We know that it's better at picking up cancers and that we have less callbacks. So it's great in both regards, really, because one, we feel more confident in the exam, and then also, as a woman that's ever had a mammogram, I'm sure nobody wants to be called back, because immediately when you get the call back, even if it's okay, there's just a certain level of anxiety there that if we can diminish that, I think that's important.
Oh, that's wonderful. I really do appreciate it. Brian, thank you so much for joining us.
Thank
you
you.
all for joining us here on
Thanks.
Healthy Living. Please have a wonderful week. Bye-bye.